This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for a new week and a new year. I'm Kyle Wiggs, and we're joined this morning by Dr. Chris Edwards, Emergency Services Director of Mon Health Systems and Chief Administrative Officer of Mon Health Marion Neighborhood Hospital. Also, Carla Hamner is with us, Hospital Administrator, Mon Health Marion Neighborhood Hospital. First of all, Dr. Edwards, good morning to you.
Good morning, Kyle. How are you doing this morning?
Doing well. Thanks for coming on. And Carla, good morning.
Good morning.
Thanks for each of you for joining us. I know, Chris, you've been on the show many times. Carla, have you been on Mon Health Talk before?
No, sir, I sure have not.
All right. Well, tell us about yourself.
I am the hospital administrator, as you said, at Mon Health Marion Neighborhood Hospital here in Whitehall. I've been with Mon Health for several years. Love working with them. And we do some great things down here at Mon Marion. So,
okay. Well, before we get into the topic at hand, and that's blood donation, tell our listeners a little bit more about the Mon Health Marion Neighborhood Hospital. Chris, how long has it been in operation?
Well, December 14th, we celebrated our third year. We've seen consistent growth year over year, which is awesome. The whole purpose is, many years ago when the old hospital at Fairmont had shut down, we wanted to give the folks of Marion County and the region another option for health care. And we're proud to say we were able to do that. And like I said, we've seen continued growth both in our emergency room and inpatient year over year. This past year we had double-digit growth, which was very exciting for us. We, over the years, have offered many other choices, such as outpatient CT scans, ultrasounds, X-ray, lab. This past year, we added outpatient MRI, so we continue to add services to the area. So it's very exciting for all of us that work there, for Mon Health, for Vandalia, for the community that we serve.
Really, it's staggering to think that it's already been 3 years.
Yeah.
Carla, what type of feedback have you gotten from the community and from the patients there? That's something that I would imagine was very welcomed, the opening of this facility in Marion County.
Absolutely. The community has embraced us, and they enjoy being able to stay closer to home for all their health care needs. And occasionally we do have to transfer to the medical center, but if we can take care of them right here next to where they live, they do enjoy that, and we've seen nothing but positive feedback from our community. Okay,
so January is National Blood Donor Month. And Carla, let's start with you on this topic. Why is blood donation so important?
Well, we know that blood donation saves lives, so we definitely need, from time to time, people will need blood transfusions for various reasons. It could be an emergency, a trauma, it could be a surgery, cancer treatment, or even just chronic illnesses. And blood is ever being used constantly, so it needs to be replenished. There's no way to make it. We can only use what we have donated. So we have that constant demand for that supply of blood. And we definitely, anyone at any point in their life could need a blood donation to save their life. So It's very important that we continue to have those blood donors.
Absolutely. Whether it's an accident, whether it's a surgery, there's many other reasons. Dr. Chris, from your perspective, obviously you see it each and every day, the need for blood. How, in terms of the necessity, where are we at with the blood supply?
So currently we're doing okay on our blood supply, but we see ebbs and flows throughout the year. Different time periods will use up different amounts of blood. The big one is that, our trauma centers, like you said, that have to use blood for our trauma victims who sustain life-threatening accidents, definitely need the blood. We tend to see the utilization a little more in the springtime for our blood usage. We have like Carla said, our chronically ill patients who have different disease processes that eat up their red blood cells that require constant blood transfusions, a lot of times scheduled blood transfusions to maintain. The challenge is that, when the blood banks distribute the blood, it's frozen. And when we thaw that blood to use, a lot of times, even like our helicopter services, our air evac services, they will take blood on every run they have with them. And if that blood gets thawed, it cannot be reused at that point in time. And you never know when you're going to have to use it in those trauma situations. So that's the importance of us keeping more than enough supply on hand, and the importance of the blood drives that are done, not only locally but nationally.
Mm-hmm. Chris, what's the most, each of us probably should know our blood type. I don't know it offhand, but I know I have a card in my wallet that has my blood type. What's the most common?
Well, so you've got kind of what we've looked at is kind of our universal donors and our universal recipients. And our universal donor is O blood that we use that can be used for pretty much anybody.
Okay.
Sorry, I apologize there. I got stuck. It's O negative blood specifically. That's our universal donor, and that can be given to anybody, and it doesn't have to be cross-matched or typed at that point in time. So that's what we typically give in emergent situations. And so that type of blood, if someone has that blood, it is utilized more than anything else. Otherwise, if someone's stable and needs a blood transfusion, we will do a cross-match and type to do a match-specific blood. AB negative is the universal recipient. They can get any type of blood that is out there also. So those are the important ones that we have.
Okay. Carla, in terms of giving blood, can someone come to the hospital, come to the facility and donate blood, or does it have to be a designated blood drive location or event?
It does have to be a designated blood donation drive. So we would love it if we do have one scheduled for January 8th here at the Middletown Commons at Whitehall. So, but you do have to come to a designated blood drive. And some people are able to donate more than one unit. They do have what they call power red donations. So some people are eligible to actually donate 2 units of blood at a time.
Okay. So, again, this is just a situation where you just kind of need to pay attention and look for opportunities in your community to give blood, which, I think most of us are open to do. Who is eligible to donate blood? Carla, let's start with you there. Who is eligible to donate blood to help someone else?
Most healthy individuals between the ages of 16 and 65 can donate blood. Now, there are some specific guidelines that you have to meet, and they test all of that prior to you donating. But it's pretty easy to do also, and it doesn't really, it's not painful or anything, so they make it pretty comfortable, and they have a really great process to make it relatively quick.
Mm-hmm. So is there anything that eliminates someone from donating blood?
Some chronic illnesses can eliminate people from being able to donate, but there are very few things that would prevent someone from donating blood. Okay.
So, again, what type of screening process is there for someone who wants to donate?
So when you show up, they do a few tests just to check to make sure that you have a good amount of blood already. So they may check your hemoglobin just to make sure that you have enough to donate. And there may be some weight requirements and just minimal requirements. But again, it doesn't matter if you have a tattoo or you take any medications, you can still donate blood if you use medications and may have tattoos or anything like that.
Mm-hmm.
So.
Okay, so not much eliminates you. We are with Dr. Chris Edwards, Emergency Services Director of Mon Health Systems and Chief Administrative Officer of Mon Health Marion Neighborhood Hospital. Also, Carla Hamner, Hospital Administrator with Mon Health Marion Neighborhood Hospital. Again, January is National Blood Donor Month. We'll take a quick break. We will continue the conversation on Mon Health Talk. We're back right after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday and for the new year, 2025. We're with Dr. Chris Edwards, Emergency Services Director of Mon Health Systems and Chief Administrative Officer of Mon Health Marion Neighborhood Hospital, and also Carla Hamner, Hospital Administrator, Mon Health Marion Neighborhood Hospital. Okay, we're talking about blood donation. January is National Blood Donor Month. And Chris, you said earlier that the supply right now is in pretty good shape, but we've all heard it, that from time to time there becomes a blood shortage. What causes those? What causes the hospitals and the medical facilities from time to time to run short?
The biggest thing that causes it is the natural disasters that we deal with. So, when we had in the fall, we had the back-to-back hurricanes that ended up devastating areas of North Carolina. We ended up seeing lots of usage of blood then and started having some lower thresholds at that point in time, and we're able to rebuild here through the winter months with the blood drives. A lot of times in the springtime, when everybody comes out of the winter and starts getting outside more, we tend to see more traumas and potentially more blood usage at that point in time also. But those are the kind of the bigger driving factors behind it.
So in instances like that, specifically the North Carolina situation, they'd never seen anything like that before. It was unprecedented, and obviously so much devastation. Do areas, do states, do regions share blood? Like, would you ship blood from West Virginia or Mon and Marion County to those areas to help them with their need?
So we, as a hospital entity, we wouldn't do that ourselves, but the American Red Cross has the regional blood banks and are able to move supply to areas that would get hit like that would have a sudden need for more supply at that point in time. So that is managed by them, which is good because it's one entity who's managing that, and we all know that when that's the case, it seems to be a little smoother in those circumstances.
Right. Carla, obviously blood has a shelf life, so that's why there's a constant demand. If someone donates blood, again, how long is it before that is used? How long is it before that blood, if it's not used, becomes unusable, if you know what I'm saying?
So once the blood is thawed out and sitting on the shelf, we have about 42 days for the blood. And then sometimes, they do break down different things within the blood. So platelets may only last for 5 days after we put them on the shelf. So there are different things that have different shelf lives for using blood. And just for instance, in 2024, we were able to transfuse 43 units of blood here at Mon Marion.
Okay. And again, most everyone is eligible to donate, but I would imagine it's really a kind of a small percentage that actually do donate. So, Carla, what would you say to someone out there to encourage them if they've never done it before, or maybe they did it when they were younger and they got out of the habit? What would you say to encourage people to get involved in this and donate blood and help their fellow man and woman out there?
So, yes. So there is a small percentage of a donor base, but we would love to have everyone donate blood. And again, when you're donating that blood, you're actually saving someone's life. We're not giving blood transfusions to just anybody. These are things that are needed to improve their quality care or their life, and sometimes these are actually saving their life. So a simple, it takes maybe 45 minutes to an hour of your time can save someone's life down the road. So it's very important, just to take that opportunity and to help your fellow neighbors and community by donating the blood.
Yeah, that was my next question, the process. If someone is out there listening and they've never done it, You talked about the time frame, 45 minutes to an hour. What's the process like?
So you come in, and again, they do an initial testing to make sure you meet all the qualifications for blood, and then again, they put an IV in that's going to remove the blood, and it only takes about 45 minutes to an hour. They get their unit, they give you a little snack, and they send you on your way. So it's really easy. It's a mild discomfort. So there's no reason not to donate.
Yeah, they check on you constantly. They're with you. They're monitoring you, and then obviously when it's all finished, they make sure you're okay. They're not going to send somebody wobbling out the door. They're going to make sure that you're 100% before you get up and leave the table and leave the building, right?
Absolutely. They make sure that you're recuperated and good, and then they will send you on your way.
All right, Chris, one more time. The importance of giving blood. Kind of give your pitch as a doctor, as a physician out there. You see it every day, people in need of blood. What would you say to encourage people to get involved?
Well, the short of it is that we never know when we're going to need it. None of us do. And so when we have the opportunity to, you kind of hit the nail on the head, to help our fellow man, selflessly help our fellow man by simply donating an hour of our time and a unit of our blood. Because again, like I said, we never know when we're going to have that need, and we're going to need someone to help us out at that point in time. It's a very easy process. It's outside of getting the first little needle poke, it's a painless process, and it takes an hour to save a life, essentially. So it's, come out, help out. It's very easy to do. We're obviously having our event at Whitehall. You can actually go onto the American Red Cross, and they have on their page, you can search by zip code to see all the areas and times and events that you can donate blood in your area. So if you're not able to make it to Whitehall and still would want to do it, you can simply go to the American Red Cross website and find a donation event in your area. It's very easy to do. And again, when you come down at your point in time in life that you need some blood, you're sure going to be appreciative of somebody who donated. So when you're healthy and able to do it, why not do the same to help out somebody? Yeah,
absolutely. And again, I believe I have the website here, www.redcrossblood.org. redcrossblood.org. Again, redcrossblood.org. That is the American Red Cross. They're an excellent resource to learn about eligibility and blood drive locations. And I would imagine a community like Morgantown, a community like Monongalia County, there's probably multiple blood drives. There's multiple opportunities to get involved and give blood. So go and check it out, and I'm sure they'll have locations and times for blood donation centers, redcrossblood.org. And as Carla mentioned earlier, this Wednesday, January 8th, there's a blood drive in Whitehall from 11 a.m. to 5 p.m. at the Whitehall Event Center, 2600 Middletown Circle. So anybody who's interested in giving blood there, they can go to that website as well, redcrossblood.org. Well, we appreciate this. This is extremely important, obviously, and we appreciate your time and your information to discuss this. Dr. Chris Edwards, thanks for your time. We appreciate it.
As always, thanks for having us. Look forward to talking to you again.
And Carla, thank you as well.
Thank you so much. Appreciate you.
Carla Hamner, Hospital Administrator, Mon Health Marion Neighborhood Hospital. That's our show for today. Thanks for listening to Mon Health Talk.